Hi everyone, and welcome to Nairita's talk. Today I'm visiting Valiant Clinic at Dr. Shadan Naji to demonstrate her signature treatment in face contouring. So hi doctor.
Hi Nairita, how are you?
Thank you for having me here.
My pleasure.
So today we're doing your signature treatment. So can you tell us more about this?
Today we are doing PRP with the SRS meso treatment.
I love this
together.
treatment.
It's
Actually, this is me after 15 days. This is the result.
So the objective of this treatment is that we want to rejuvenate the skin in a very, very natural way. We are using two techniques together. We are injecting the PRP. We all know that when we use a very good kit of PRP with high concentration of platelets, we are able to booster the remodeling in the skin in any tissues that is undergoing remodeling. When we do, in addition to the injection of the PRP, the microneedling, the aggressive microneedling that we will see as today, with the meso product, which is the SRS, that means that we are triggering a process in the skin to be renewed, to be rejuvenated, and we are giving a booster by injecting the PRP. So the effect is maximized.
Okay, so this is the vampire treatment? Is it
It's called it's called sometimes the vampire facial, the vampire treatment, but it's
we're calling here SRS PRP
combo.
Okay.
The most important thing is that we need to know that we need to use a kit that gives us at least double the concentration of the platelets. This is very important, and that's not the case with every type of PRP. That's why we need to ask about which PRP that we are using. It's very important to inject the PRP, and we will see that we are going to inject the whole amount of PRP in the skin. We're not going to put it superficially, because when you put it superficially, the effect is really minimal. What we are doing is we are injecting the PRP. We will see that we inject around the eyes. It gives a very beautiful results on the under eye area. Rejuvenation, remodeling, renewing of the area without the need of filler. I usually do it either alone or after doing fillers for around the eyes. It helps with doing the microneedling, what we are doing now, to improve the skin quality, tighten the skin, reduce the fine wrinkles that is there, and as in our patients, it will help for treating the acne scars. This is one of also of the indications that sometimes we treat with this approach, is by doing the aggressive microneedling with the SRS combo and then injecting the PRP. What is the SRS combo? SRS is a type of meso product. We do our own cocktail that contains many ingredients. One of them is hyaluronic acid, non-cross-linked, which gives a very good hydration for the skin. We have the DMAE, which give a tightness in the skin. We have a little bit of vitamin C. We have a little bit of amino acid, the peptides, the amino acid, the peptides. The mixture of these products together with the microneedling, we are infusing a very high dose of vitamins and amino acids and peptides into the skin, so the skin use it in the remodeling process. That's why we have a maximized result.
Very good.
Ready?
Doctor, another question. PRP, sometimes they say there is an activator in the PRP. So can you just specify what's the activator?
In the beginning, all the kits for the PRP used to have an activator, because the activator, what it does, it triggers the platelets to rupture and then to release the growth factor that is inside the platelets. But the problem with having the activator, it makes the growth factor longevity of life very short, couple of hours. We know now in science that collagen, our collagen, is a natural trigger for the platelets to be activated. So what we do now, we are injecting the platelets intact, and then the collagen, it triggers the platelets to release the growth factor over 5 to 7 days after the treatment. That's why nowadays, I personally and a lot of my colleagues, we don't prefer to have any kit that have an activator. We are focusing more on making this treatment extremely pure, no additive. By any means. So that means in the very low possibility of having any reaction. We have lower possibility of having any side effects or any risks after the treatment. The downtime,
and at the end, it's
your own tissues. We are using your own tissues in a smart way.
Very good. So are you ready?
Okay, so now we put numbing we need numbing because it's a little bit painful. So we put numbing for around like 25 to 30 minutes, and we are going to start by extracting the blood, and then it will be in the centrifusion. We are going to get rid of the white blood cells, red blood cells, and we are keeping only the plasma that has a very high concentration of platelets. In this kit, we are having more than 1.8, which is the required amount to have an effective treatment. We are going to do, once we finish the preparation, we are going to do the microneedling with the infusion of the SRS meso cocktail, and then we are going to inject the PRP.
Step number 2.
Exactly. We collected the blood. We took 20 cc of her blood, the patient's blood. We see that here this is only a separator. It's a gel that will not go with the sample that we are going to take. The duty of this gel is only to separate the red blood cell and white blood cell will be down, and then we will have the plasma on the superior, on the top area. So now we're going to put it here, and we're going to start the centrifusion.
For how many minutes?
10 minutes.
10 minutes. This is step 3.
Yeah, we are preparing the skin to do the microneedling with the SRS.
Okay. So are you using a normal needle or a cannula?
No, for the SRS, I'm using the microneedling, which is Eclipse, the same brand of the PRP, and this is one of the really very effective derma pen.
This is for
not all the
face.
same, yeah. And we will see that with my protocol, we do an aggressive microneedling, so it will be really red, and we will see a little bit pinpoint bleeding when we are doing the treatment, but that's okay. It will not leave a mark for a long time.
Okay. And the last step will be under eye.
The injecting full face, the full face with the PRP.
Okay. So doctor, what are the common mistakes nowadays?
So usually with PRP is really a very mild treatment, and usually it has very low possibility of side effects. But we don't recommend mixing the PRP itself with other products. Like there are a lot of companies, sometimes they mix the PRP with the hyaluronic acid or other meso product. They mix the product itself in order to be injected. We don't prefer that because that increases the possibility of having allergic reaction. There are cases when we are using not reliable kits, we can have a possibility of allergic reaction if there is an activator in the tube itself, if a part of the gel for any reason comes out and then we inject it, that might create an allergic reaction in the patient, although the product itself is from our own body. So it's very important. Number 2, also, as I said, the topical PRP does not give us a very good result. We need to inject it in order to get what we want from the PRP. It will be similar to any meso treatment when we are doing only the PRP facial, when we are putting the PRP topically, and then we are doing the microneedling. Okay, now this is the SRS cone. This is my own mixture. It's different products from the SRS.
So this is your signature treatment?
My combination.
Very good.
So now, one thing also that we also control when we are doing the microneedling, we use different depths on different area of the face. So like on the forehead, we will use 0.5. On the face in general, because it's thicker, we are going to use 1.5. It will be only a tingling sensation, okay?
And this is very good for the scars.
It's very good for the scar. We are going to be more aggressive on the scar area. We can see here we have an atrophic scars. So doing the combo treatment with the PRP on the scars itself, it gives a very good improvement. It's possible to repeat again after 3 to 6 months, one session, just as to freshen up and to improve and make the effect last longer.
I think the PRP
beautifully
is
red.
ready, right? Yeah.
We love this redness.
So if it's red, it means
we created a controlled inflammation in the skin. Now the skin, we activated within your skin a healing cascade. So the skin is starting to repair itself, okay? And we are going to give the skin another source of product, which is your growth factor, to make this process more maximized and more efficient. You see, this is our plasma. It's totally separated. Here we have the red blood cells and also the white blood cells. We can see the gel is stuck to the lower part, and we have the plasma, which is free and
separating
also
so the gel was
very
separating
high
from the red.
in platelets. So we said one of the effect of the PRP and the advantages of PRP is that it helps to remodel the around the eye area. A lot of patients, they complain about this area. They see that there is darkness, there is a little bit of depression. They look tired.
Yes.
One of the solutions is PRP. Whether we need to do before filler or without even doing the filler. The PRP helps to renew the area, rejuvenate the area. We will have tighter skin. We will have less darkness around
even the darkness,
skin.
right?
Exactly. And also less wrinkles, especially in the lower eyelid. We are going to inject the PRP the same way we inject fillers. It will be a little bit more superficial, but we are going to inject it all in the tear trough area exactly the same way that we inject the filler. So we're using the cannula.
So you're using the cannula. Can we talk also about the cannula,
Close
doctor?
your eyes.
So what is...
Cannula is a type of injection techniques that allow me to go under the skin without having to prick the skin multiple times. You only will feel a little bit of pressure, okay? We are inside. I'm going to be able to distribute the material all over the tear trough area, which is around the eye area. This is something that we use just to reduce the pain. I'm going to focus in injecting the acne scars. In general, we inject the whole face, we inject around the eyes, and we inject also the nasolabial folds because it helps to support this area.
I really liked the eye treatment. I usually don't ever touch my eyes. I did it once long time ago and it hurt and I bruised. So this technique, I feel it's very comfortable, first of all. And the fact that there's less chance of bruising makes a huge difference too.
Yeah, definitely. This is one of the reasons a lot of patients ask about this specific treatment because they really want to treat the area around the eye but without over treating the area. This is something that we talked about before. It's not always the filler to solve the area around the eyes. We need to really rejuvenate the area around the eye. PRP is really one of the main treatments that really helps in this area. With time, myself and a lot of my patients, after doing the initial filler treatment, doing regular PRP, will make you require no filler or less amount of filler on a longer periods of time. So this is a very good approach, especially for around the eyes. I have patients sometimes who does only PRP for around the eye area. Number two, as I said, because we are using something that is really natural, so there are lower risk of having any problems or any side effects. We are getting 100% natural result. We are investing in the skin itself to have more glowing, radiant, vital skin that does not require foundation to look good.
Which is, I think, what we all need because the first thing we notice are people's eyes and the first thing I notice in myself if it's tired or eyes.
Yeah, definitely. Definitely.
Thank you.
So now, as we said, Joyce is going to apply for you a repair cream.
Okay.
You're going to use only this cream. This is also very important. It should be used for 5 days after the treatment, twice a day, with your sunblock for sure, but you can continue your life. Normally, you need only to avoid sun exposure for the coming 5 days after the treatment. We use a repair cream. This cream is Cicaplast post-procedure. We can use Cicaplast post-procedure, any type of repair cream that is rich with zinc and with panthenol.
Yeah, and when can I apply makeup or when do I apply my normal routine?
Like you going back to normal routine after 5 days.
Okay.
So whatever your normal routine is, it should wait until 5 days.
Okay.
But putting makeup, you can put from today, but I prefer to give your skin a rest of 1 day.
Okay.
But from tomorrow, you can put this cream and on top of it, you can put your makeup.
Okay.